Hello, my name is Taylor. I'm a registered dietitian nutritionist and board certified specialist in oncology nutrition. Today we'll be talking about how to troubleshoot different issues that you may be having with your feeding tube. We're going to look at whether or not the tube is coming in or out, if there's any clogs in the tube, if there's an infection, or if there's any problems like nausea, vomiting, or diarrhea. We'll talk about what these problems are and when you should seek medical help to solve these problems. Stay tuned to learn more. So first, we'll talk about whether your feeding tube is falling out or being pulled in. So here I have an actual feeding tube, and when it's in your body, this part, the balloon or mushroom part, will be on the inside of your stomach, and this part will be on the outside. Now, usually these things hold it in place pretty good, and it doesn't typically fall out, but it can happen, and so what you need to look for is that the numbers on the feeding tube are changing. So here you can see there's different numbers along the feeding tube, and I recommend keeping track of the number that's closest to your skin. The number that's closest to your skin should usually stay the same. It might shift a little bit, but in general it will be about the same number. So let's say you're at about a 5, and one day you look down and it's not at a 5, it's at a much higher number. It's at maybe an 8 or a 9. That would suggest that your feeding tube is being pulled in. And if you look down one day and it's not at a 5, instead it's at a lower number like a 1 or a 2, that would suggest that your feeding tube is falling out. Maybe you caught it on something, or maybe it got yanked on. So in that case, what you should do is you should call your medical team. If you got it placed by a gastroenterologist, you can call them, and they can usually get you in, take a look, and see if it needs to be adjusted. If you got it placed somewhere else, perhaps interventional radiology, or got it placed in the hospital, then you might not be able to go back to that place to get it looked at. So in that case, you should call one of the providers on your team, such as your doctor or your physician assistant or an ARNP, and ask them to take a look at it and see if it needs to be adjusted and what you should do next. They'll be able to get you in pretty quickly if it needs to be taken care of. Now, typically you should get it taken care of as soon as you notice there's an issue. So try and do it within the day or the next day, because if you think it's shifting, you probably should not be using it for feeding. So when you do notice that it is either falling out or being pulled in, call your team as soon as possible to get it taken care of. Alright, so now let's take a look at feeding tube clogs. The good news is usually these can be fixed at home. So if you can see the clog, then the first thing you should do after washing your hands is to take the clog between your fingers, pinch it, and roll the tube between your fingers. And this really helps to break up whatever that clog might be. After you do that, take your syringe, fill it with water, and flush your tube out like normal. And in many cases, that's enough to kind of clear out the clog. If yours is a little more stubborn, don't worry. Or if you can't see the clog, it's further in, this will work for you too. What you'll do is you'll take the syringe and the plunger. Now normally I say let things go by gravity, but in this case you'll need the extra force. So fill the syringe with water, then take your plunger and you'll push through the feeding tube. Now what you'll notice is it's actually a lot harder to push this part down when there's a clog in the feeding tube. So if you're feeling weak or tired, you might have to ask somebody for help to really help push down through the tube. Now once the clog is pushed out of the way, you'll feel it because it will go from being very hard to push to very easy to push. So that will kind of let you know that the clog is cleared. Once it's cleared, you're good to go. Just flush the tube out again for, good measure, and you will be just fine. One of the things to avoid when you're fixing a clogged feeding tube is the frequent use of soda or cola. Now, a lot of people, doctors, nurses, and dietitians included, will tell you that a little bit of soda down the syringe and into the tube will help break up the clog and help you flush out your tube like normal. It does work. However, I don't recommend doing it frequently because just like soda is bad for your teeth and can eat away at that, it can eat away at the inside of your tube if you're using it frequently. So try to use the water and the syringe method first. If that doesn't work, you can give the soda a try. But overall, don't do it too frequently or it can damage the inside of your tube. Now, another thing to avoid when you're trying to fix a clogged feeding tube would be putting sharp or long objects down into the tube to try and push the clog out of the way. That is a really bad idea because oftentimes you can introduce things that might lead to infection, or worse, you can puncture the tube or even yourself if these objects are sharp. So overall, it's very dangerous, and I don't recommend sticking any foreign objects into the tube to try and fix the clog. Instead, try and use the plunger and some water, and if that method does not work, then call your medical team for some assistance. When it comes to your feeding tube site, you're going to get pretty used to how it looks normally. The first week there might be a little bit of red for blood or a little bit of brown if there's dry blood, but other than that, it's going to look a lot like your normal skin, and there might be a little bit of darker pink around the area of the feeding tube site. Very, very normal. Now, if you look down at the feeding tube and there's any white pus or green pus or anything kind of oozing out around the site, or if it's really hot and tender around the area and it's, hurting a lot, then call your doctor. All of those can be signs of infection, and those are not normal, especially after you've had the feeding tube longer than a week. Those issues need to be addressed immediately, so call your doctor as soon as you can. So the last issues that we'll talk about today are troubleshooting nausea, vomiting, and diarrhea. Those issues are often triggered by the formula, perhaps by how fast you're doing the formula, maybe by the type of formula, or potentially how much you're taking at a time. So on average, the formula comes in 8-ounce containers, whether they're cans or cartons. You can get through those pretty quick. I've seen a patient do one of their feedings with a can in about 2 minutes. However, I do not recommend doing that. Just like you wouldn't take a plate of food and dump it straight into your stomach, you shouldn't take your formula and pour it in all within a very short amount of time. When you're eating, things slow you down. Perhaps talking at the dinner table, chewing, and swallowing will make it take longer for you to eat. And that's why I recommend taking 15 to 20 minutes per can or carton. And that will help prevent you from eating too quickly. Because when you eat too quick through the feeding tube, you're likely to get the nausea and perhaps vomiting or maybe even diarrhea. The other issue that a lot of people have is taking too much at once. A lot of people are able to handle 2 at a time, no problem. But some people can only do 1 at a time. And in that case, to get all of their formula in through the day, they have to do more frequent feedings. So pay attention to how your body feels. If you're bloating too much or getting too nauseous after a feeding, even though you're doing it slowly, perhaps you need to try a smaller amount more frequently throughout the day. Now, the last thing is the type of formula. There are a lot of different types of formulas out there, and just like not every person can tolerate every type of food, not every person can tolerate the same type of formula. So if you are doing it at a good speed and you're not doing too much at a time, and you're still getting those issues like the nausea, the vomiting, and the diarrhea, perhaps reach out to your dietitian or formula provider and talk about different formula options. It's really important that you find the right type of formula for you and your body, because this is your nutrition and it's what's going to get you through all of your treatments, healing and feeling good. So be sure to talk to somebody if you feel like you're not tolerating your formula. Thank you so much for watching this video about how to troubleshoot issues with your feeding tube. Be sure to check out my other videos on feeding tube care if you have more questions. My name is Taylor, and I hope that you have a happy and healthy day.